Robin, and now talking about Irma, your site has been identified as someone that I might be working with on that grads integration, and we talked about that a little bit last year.
Yeah.
For your site visit.
Yep.
So we have an opportunity with some funding from PED to do some more work, and that would fit into some of the things that Dan's going to be bringing up today and some of the other sessions where those students are going back and forth between the school-based health center services and others. So, it's integration, sort of looking at it from a slightly different angle. So,
Yeah.
Okay, maybe
great.
we get Dan to help us on sort of navigating that.
Excellent. Excellent.
And the navigation issues can be talked about in the provider case conference forum as well. Anything you want to bring to the table that presents a challenge for you as a behavioral health provider and integrating behavioral health care for students, that's all what we'll be discussing here.
Excellent.
Okay, and as we'll touch on in a little bit, there continues to be the telepsychiatry consultation as well to support you with your work.
Great.
Okay, and also to see when the forum is taking place and when we're having webinars as well, we can always go to, I'm going to have to ask Kevin here if he may be able to help me get over to our browser. There we go. If we go to right here,
Nope. Don't want to do that.
I want to add in. I want to
You don't
open
wanna
up. I
stop
want
your
to
session.
open up another.
The Envision calendar.
There we go. Okay. Reopen a closed tab. Pardon our little technical difficulty here, Robin,
That's
but I thought
okay.
since we were talking about it, here we go to the Envision New Mexico website. Here's our calendar. You'll
Yeah, and I've been
see-
looking at that actually, so I should probably bookmark it.
That's great. And
Yeah.
here you go for September 18th. Okay? School-Based Health Center Provider Case Conference Forum. So all of these webinars and forums will be posted on the calendar. Here's the next one in the series of School-Based Health Center webinars right here. Okay?
Good.
So you have that available to you as well, and will certainly be a tool you can use to notify you of upcoming offerings.
Yeah, and I noticed you're kind of proactive about emails too, so that's good.
Yeah, that's our Clancy helping us out with that. And also on the site for today's conference, you'll see the curriculum that goes into a bit more detail. Just about the same amount of information about the forum, but the upcoming QI webinar topics. You'll see one-liners for all of them. And
I'm sorry, how
dates.
did you get to this one?
This one would actually be going back to our website.
You were under Explorer. Mozilla. You were in Firefox.
Yeah, I would just use Firefox for now. It's in
Trying.
full screen mode or something.
Trying, Kevin. I'm gonna.
That's weird.
See it there.
When if she comes, send this an email to her.
There we go. Thank you.
It's
If you go back to click on today for the 27th, you'll see curriculum handout as well as the PowerPoint handout.
Oh, good. I was looking for those, and for some silly reason, I didn't see that
And
tab.
it's the same thing. I have it right now on our desktop here, but you'll see this one-pager handout, and it will list all the upcoming webinar topics from today's overview through webinars about the student health questionnaire for multimodal screening, student depression and anxiety, behavioral health assessment, therapeutic communication, behavioral health treatment, and conducting quality wrap-up team conferences. All of the topics that we were just looking at on the PowerPoint with more elaboration.
Great.
So without further ado, let's overview. Let's go to how we begin our school-based health center care with screening. Okay. Now, we can get all enmeshed in screening. It's because it's such a crucial component of comprehensive school-based health care. All the students that we see in school-based health centers, and certainly throughout New Mexico, all of the DOH-funded school-based health centers screen students for numerous health, safety, academic, behavioral health, and psychosocial risk factors. And we do that with the SHQ according to OSA's standards and benchmarks. Consequently, in addition to receiving direct referrals for behavioral health services, as we would receive in a community behavioral health clinic setting, school-based health center screening results in referrals as well of those students who screen positive and go on perhaps to have some preliminary assessment that indicates a need for behavioral health services. And that would be done according to this scheme. With our SHQ under screening tools, we have the PHQ-2 modified for depression. If either of those two items is positive, that's a positive screen. If either two items for anxiety is positive, that's a positive screen. And in those cases, we administer the PHQ-9 modified as our assessment instrument for depression, and respectively, the SCARED as our assessment instrument for anxiety. This is really
That's
a foundation.
not a tool that that's not
Go
a
ahead.
tool I have, by the way.
Well, you tune in here, Robin, because we're going to be talking about that.
Cool.
I'm a dude who's not afraid to talk about the SCARED.
All right.
All right? We're going to be talking about the SCARED. And if we're not getting to it as fast as you need it, arrange for a telepsychiatry consultation. Okay?
Okay.
And we'll get to it quickly. All right? You know, and people are less familiar with the SCARED. It's, it comes out of a single center in Pittsburgh, whereas the PHQ-9 was the result of a multi-site effort and funded by Pfizer Pharmaceuticals. So the PHQ-9 has gotten a much greater audience than the SCARED has. We'll be able to get that to you.
Thank you.
And this really becomes very important in identifying depression and anxiety by the screening of all the students in the school-based health centers, the assessment of those who screen positive using the longer assessment instrument that we just talked about, then using a sequential approach so that it isn't everything falling on to Robin as the behavioral health provider to deal with everything behavioral health. Or if Dr. Torres has a student who screens positive for depression or anxiety risk factors, it's not all falling onto the shoulders of Dr. Torres. That we have this team approach that ends up involving some changing of hands and shorter steps, but ultimately meets the need of student identification of, or I should say, identification of student depression and anxiety. And these are steps that become elements in the school-based health center quality improvement initiatives that we've developed for behavioral health and for integration. They have these elements in common: the screening, the assessment, the team conferencing. And as you embark on that further, Robin, at your site, or if Dr. Torres is working in a school-based health center that becomes involved in a school-based health center quality improvement initiative, we will delve further into these elements. So team conferencing, go ahead.
No, I guess you aren't on the. I'm looking at your But you haven't gotten to the Molina part of it, right? Or no? I mean, will the school-based health centers get reimbursed by Molina if they refer patients through?
Sure. And Dr. Torres, I ended up leaping over that as we were getting underway earlier, but certainly we want everybody to know that any case that is discussed in Envision telehealth programs, the time that a provider spends doing that is reimbursed by Molina. And that there
Oh, so
are
case
mechanisms.
conferencing is
Well, what
Is
it
that
says
Robin?
that Molina.
Yeah. I was just wondering if so conferencing is a reimbursable activity.
Correct.
I had no
Correct.
idea.
Well,
That-
with
Molina.
us, not with
us.
not with each other.
Here, by attending
Yeah.
the school-based health center provider forum, bringing a case to the table for consultation and discussion. The time that you spend doing that, the indirect service that you're providing is a reimbursable service.
Okay. Cool.
And I understand that this slide is on your handout as well, that's available at our Envision New Mexico site.
Okay.
Where we were on the calendar and it showed where the PowerPoint presentation is. This slide is in that PowerPoint as well. And it describes the code and other information needed.
Excellent.
Okay? And in fact, Robin, we haven't actually updated this to include the school-based health center provider forum yet.
Okay.
Dr. Torres, especially since you had asked about the Molina connection with our programs, I want you to know that another forum similar to the school-based health center provider forum is what we call TPIC for pediatric providers. You're welcome to attend that one as well. That's the first Wednesday of the month during the noon hour.
Okay.
So we'll be conducting that one next Wednesday, September 4th.
Okay. I will look for it on the email, because you guys are pretty good about emailing
Great.
that out, so I appreciate it.
That's right. Once you get on Clancy's list, you'll never get off. So
And you can find it on our calendar as well. So we were right on team conferencing, which we emphasize because it's so important in all of school-based health center care, especially when we're integrating for behavioral health care. In our team conferencing, we're discussing referrals, screening, assessment, treatment. And it's also important because it's an OSA standard in the care we provide in school-based health centers. So we want to begin our collaboration early. So we want to integrate the care within our school-based health centers. We want to effectively collaborate with school providers, which gets into that navigation that Kirsten was talking about earlier. And we want to coordinate school-based health center care with community providers and agencies. We were talking earlier about school-based health center team members who can be Robin as the behavioral health provider, your healthcare provider. You may have, you mentioned case manager, anybody who's involved with your team integrating the care, collaborating with the school nurse, social worker, psychologist, others, and again coordinating with the community. A Venn diagram describes this overlap very well, but there are numerous other dimensions to it. And it's interesting that there's been so little written about how much we do in providing indirect services and how we end up having multiple overlapping broad provider roles in school-based health centers in providing indirect services, which can include education to educators, administrators, school providers, and even students about health and mental health issues. And I found this interesting that in this article by Mavis and others, 2009, Journal of School Health, it described how school-based health center providers spend 20% of their time providing these indirect services. I would increase that easily to 25% when including team conferencing. And basically, those of us who are doing this work know that by working together as teams in school-based health centers in an interdisciplinary collaborative fashion, we're able to do more for students than any of us can do on our own. Well, what are some of the treatment approaches that we use in school-based health center integrated behavioral health care? There are usual modes that are combined for psychotherapy, psychopharmacotherapy when it's indicated, and care integration involving the provider collaboration both during student visits and team conferences. We find that multimodal treatment is advantageous. It's been shown that the combination of therapies enhances efficacy. It's consistent with the biopsychosocial model. It addresses comorbidity. It's been shown that the integrated care is efficacious, and that psychotropic medication combined with psychotherapy usually is superior to either of those modalities alone for the treatment of depression, anxiety, and coexisting conditions. And when we get to talking more about behavioral health treatment as part of this series, we'll look at the evidence for that, because it turns out that the most frequently cited study about this is also used to cite how psychotherapy alone can be as effective as medication plus psychotherapy. And we'll talk more about why this information is cited in various ways. In school-based healthcare, we can develop some of the most comprehensive multimodal treatment plans that, in addition to the psychotherapy and indicated psychopharmacotherapy just described, can include lifestyle considerations for nutrition, activity, substance use, or that is decreasing substance use, maintaining healthcare visits, and case management if needed. So especially for our behavioral health providers who are embarking on behavioral health care of students, you don't have to be the Lone Ranger. Integrators are always welcome. And, I'm not sure.
That was it? We're integrated
No.
now, and so we're...
No, it wasn't advancing for me. Because we find these recurring effective principles, practices, and programmatic applications. We're finding that the comprehensive multimodal, multidisciplinary principle applies. Care integration involves collaboration in ways we've already described. There's a continuous collaboration in our practices involving the teams. And when we apply a formalized team conference and regular monitoring and prescribing, if prescribing is involved, we have good outcomes. So knowing that we've got a limited window here before Robin leaves, I want to invite any questions, concerns, comments, beliefs, or thoughts before we get to meet on that third Wednesday in September for our School-Based Health Center Case Conference Forum.
I don't have any questions. I think you've been real clear.
Well, sure appreciate you joining us.
Yeah, thank you so much.
And Robin, now that we've got you on the line, when do you want to have your first site visit for us at Bernalillo?
Well, I'd have to sort of huddle with my colleagues around that, but
Good answer.
yeah.
Very good answer.
But yeah, I think sooner better than later. I whatever. We're just so relieved that our credentialing was successful last year, and that it's we don't have that hurdle to deal with. It's sort of like, oh, this is anything else is a piece of cake after that.
That's good, because if this is the place you want to work, if this is beneficial, then this is certainly what we could reinforce when we're out there at your site.
Yeah, absolutely. I think because we're all part-time, and because we're trying to have some coverage on more than 2 days, which is what we all have allotted. We're not here all at the same time, and it makes this integration more challenging. So I think we're going to have to get real intentional about it.
I think, Robin, it's Dan again. I think that's all the more reason to get efforts underway to have that first site visit sooner rather than later.
Yes, absolutely, because it's sort of like it has to get formalized, and we have to get it institutionalized, kind of.
That's right, because as you pointed out, you're especially challenged when you're not all there together at the same time under the same roof. And how do you formalize team conferencing under those circumstances? Yeah,
and we are, there's a more overlap than not, I would say. But still, when everybody's running 6 ways to Sunday during the time that we're here, it's not so easy to do that integration. I mean, we opened, and the nurse practitioners have been doing this flood of sports physicals, and I'm getting my slow, steady start, but real different paces going on right now.
This is Catherine. So I just want to make sure. So are the school-based health centers, is Medicaid reimbursing them? Are they still having problems with that or not? Or did they get that? Because I know there was a time where they weren't, and then, now that there's been all these changes, how with the new Medicaid that will be coming out, will school-based health centers be okay, do you guys think, or not? That's my question, especially when it comes to behavioral health.
Well, we've been going on the assumption that the nurse practitioner here has some prior history. I think she left in 2006, and she came back last year to work, after the clinic reopened. And what she said is, as long as, we do the PE MOSAs, that there are 3 months of, even if the student is turned down, that there's 3 months of, sort of assumed eligibility that they'll pay for.
Also, Dr. Torres, this is John Martinez at Envision. With OSA's help and assistance to do the 3-year revolving contracts, has provided some consistency, I think, for the providers, so that there was a lot of work done with credentialing last year, but I think most of the school-based health centers are through that process, so they're in a better place this year.
So with the 100, with that 100, because I'm going to be seeing Mary Kay Papin on Monday, so I want to be able to talk to Senator Papin about, just to let her know how this is working out. Do you feel that, so this is just starting, right? The reimbursement with Envision? Is this just, because I was reading it, but this is new, right? This is something that providers can do now, and that way with Molina patients that they will get, including the school-based health centers, will be, if they do the screening and you're working with Envision, that $150 will go either to the school-based health center or a private provider. Am I correct on that? I just want to make sure
Dr.
that I'm
Torres,
understanding.
I'd like to attempt to clarify a couple different kinds of reimbursements and look to my colleagues around the table to help me stay claro, I was going to say, and also honest, but I think I'm being quite honest by saying that my understanding is these are two different levels of reimbursement. That the Molina reimbursement is for an indirect service to students that comes by way of provider consultation, contacting Envision New Mexico for consultation through one of our telehealth programs, as outlined in that slide we reviewed earlier. On the other hand, school-based health centers have had increased efforts on numerous levels to enhance reimbursement for direct services.
Okay.
And that would be the direct service provision to students. And the levels have included each program that is providing services have been getting a lot of technical assistance to increase their reimbursement so that they can be sustainable through.
But they won't get.
Go ahead.
No, so not to interrupt, but so they won't be able to receive that $150 if they are so they aren't really considered a primary care, is what you're saying. So if somebody's assigned a patient, only that provider can get the $150, not the school-based health center?
The school-based health center can if they're involved in a conference and consultation through an Envision telehealth program about the student, which is an indirect service.
Okay.
So that is a reimbursement for those students who are signed up with the Molina Salute.
Okay.
Whereas in the school-based health center for direct services, the school-based health centers are billing all of the salutes respectively. Whether it's for an EPSTAT, whether it's to see a student who has a sore throat, or for behavioral health services. And
but Molina is Molina the only one that is working with Envision, or all the other salutes working with Envision as well?
As far as the reimbursement for the consultation through an Envision telehealth program, Molina is the only one.
Okay.
And that reimbursement, this is Kirsten Bennett, that reimbursement is not limited in terms of number of times. So say, for example, you were seeing a student over the summer that is also seen in a school-based health center that's open during the school year. If you were seeing that patient and managing that patient and needed help from us during the summer and were presenting that patient, you would get the reimbursement. If during the school year the student has more visits at the school-based health center and that care is coordinated by the providers at the school-based health center, they would get that reimbursement if they were the ones asking for the help. So it doesn't matter where that Molina patient is seen.
Okay.
Either by
And Molina. Okay. Thank you for the clarification.
Dr. Torres, also want to describe that there is the TPIC conference that I mentioned earlier, held on the first Wednesday of every month for pediatric providers. And this is, aside from school-based health centers, if you were to call in for a case discussion in this forum, even if the patient is not receiving care at a school-based health center, it moreover is receiving care from you in the pediatric clinic, and that patient is a Molina patient, there would be a reimbursement to you for that consultation.
Okay.
You know, and
Thank you.
to follow along on Dan's comment about this TPIC clinic, there's also the nutrition clinic and the overweight clinic, which also are specific to certain patient populations. One, pediatric nutrition, I facilitate that clinic. That's for any patient that you would need help managing nutritionally. And then we have the same set up for children specifically who have a diagnosis of overweight or obesity, in which you're dealing with those very, very specific comorbid conditions. So, there's a multitude of services available, and so it'd be great if you took advantage but also shared with your colleagues.
Okay, do you feel that, because I'm still on my little, I'm still on sabbatical is what I'm calling it, where I'm enjoying life, had not gotten back into the race of being a physician. Do you feel, have you seen an increase in Envision since Molina started reimbursing, or no?
Not particularly. It's an underutilized service. Molina, I know, we started this, I think made this official January of the year. So it hasn't been that long. But for the most part, I think the reason why Molina is actually pushing this by providing reimbursement for providers who do this is they realize that the access to specialty care is limited outside of the big tertiary care centers. And so this is a way for providers to get support for managing their patients in their communities, which makes the care better because care is probably going to be more frequent. And secondly, you don't have travel time and associated costs with families and children missing school and work to get care that's sort of intermittent. So it's one of those things that, if you build it, they will come. We're hoping that that's the case, that now that this is available, more providers will take advantage. And hopefully by Molina taking the lead, maybe some of the other managed care organizations under Centennial Care will actually do the same thing. So if you can give us any help in promoting that, that would be welcome.
No, I would love to promote it. I think it's great. And I just think physicians are not paying attention to the reimbursement part of it, because for down here, especially in the rural communities, I mean, this is great. So, and especially in helping them pay, too. I mean, it's hard for physicians now with the way reimbursement is, but I think we have to utilize it, because you all know that if we don't, the people are going to take it away. And so, in any way that I can help. So, because I know the legislators will ask about it, and I think it's important to be able to show that it is being utilized. But if I can help with that, let me know. But if you can send me some more information, because I read about it in the, in the medical, the New Mexico Medical Society newsletter, and then, I saw it now on your slide. So I want, since I'm back down in Las Cruces, I'd like it when I see providers, I'd like to, mention it to them and make sure that they're, utilizing it. So is it only? So Molina is for kids only, but there are no adult programs, yet with the adult population. I know Molina do that, but I don't know how much Molina does on the adult side of it.
They also do this for the adult clinics. So if you look at the ECHO model clinics, Dr. Aurora's clinics are the adult version of our clinics, but Molina does reimburse for patients that are Medicaid on their program in the same way, exactly the same amount through the same pathway.
Okay.
And
folks, I'm going to have to excuse myself. Thank you so much.
I'm going to ask you for 15 seconds before you go, just to say thanks for joining us. And secondly, I would want to emphasize that even aside from the reimbursement, in order to support integrated behavioral health services provided in a pediatric care setting, the telepsychiatry case conference that we have the first Wednesday that we call TPIC, depicted on this part of our website, is a valuable resource that we'd really appreciate you passing the word around for.
Yeah, I definitely will. This last year was my first year in this kind of a setting, so I'm all over any kind of information I can get. So
That's great. We have a lot of it on our website, and we thank you for joining us today.
And we'll be calling
Thank
Rob
you all.
about your site visit.
All right, very good. Thanks so much. Bye-bye.
Bye.
Are we off?
You want to be told that?
We will send her a packet. I will have Janine send her a packet that's got our annual report, Clancy's schedule, the whole
That's
bit.
great.
And we'll just do that.
That's great. Boy, I'll tell you, that is a clinical feature of perseveration.
What is?
That is a clinical feature of perseveration.